I'm Julia from Partnership Community Health Center. I work in our health insurance enrollment department. We help not only our patients but the community at large. So anybody within listening distance of this show is going to be able to access help with us. So last year, more than 400,000 Wisconsinites went uninsured for a portion of the year, and an estimated 57,000 of them were children. This means that people didn't have access to preventive care like blood pressure screenings, well visits, cancer screenings, and they also ran the risk of financial debt if they became ill or got in an accident. The #1 cause of bankruptcy in the United States is medical debt, so having insurance really helps to protect not only your health but your wallet. So Partnership Community Health Center is providing assistance in 4 communities this year: at our health center in Oshkosh, at the Neenah Winnebago County Health and Human Services Building, in our enrollment center in Appleton, and our dental center in Wapaka. So we have certified application counselors who can enroll people in English, Spanish, and Hmong. We use a language line for anyone that we don't have a language for, and we'll be there to help you in person, free, get enrolled and understand how to get coverage and care. We refer to it as the health insurance marketplace, which is the same as Obamacare or the Affordable Care Act. And even more so, people are confused about, is that still a thing? Is it still around? And the answer is yes. The Affordable Care Act is still the law of the land. There have been some changes, but in our region this year, we have more plans to choose from than ever before for 2020. The health insurance market is strong. Most people save money when they enroll in a plan on the marketplace, and we have people to help you understand how to do that. So people can enroll in Badger Care at any time of the year, but open enrollment for the health insurance marketplace is November 1st through December 15th. It's a 6-week period, and we are working nights and Saturdays to get everybody in. This will have insurance available to you for January 1 of 2020. We're going to help you fill out an application. Your pricing is based on your household size and your income. Everybody will know when they leave and have the opportunity to choose the plan that fits best for their family. We'll get you enrolled and make for sure you understand the provider network, where to go to the doctors, how your costs are going to work for you when you are insured throughout the year. If you have insurance offered through an employer, usually that's the way that you need to go, and there are a lot of people who miss their employer's open enrollment time, and that's happening right now too. So if you work for a company that offers you insurance, it's really important that you touch base with your own company to see if they have insurance available to you. So if you go onto Google right now and Google health insurance, you're going to get a million different offerings. A lot of them are copycat sites that look exactly like healthcare.gov. If you put your information into a website that's not the secure Affordable Care Act healthcare.gov website, you are going to get phone calls before you even push send on your computer. We are assisters to help you see the real health insurance through the Affordable Care Act that gives you the essential benefits and protections of having real health insurance. We'll cover your health needs. They don't have exclusions for health conditions, and we'll help you understand that process. On the healthcare.gov website, if you scroll down the screen, you're going to see a space for Find Local Help. If you put in your zip code and you're anywhere in this region, Partnership Community Health Center is going to come up for you. You can also call the United Way resource line at 211 to ask for free in-person help in your area. And you can contact Partnership Community Health Center's enrollment department at 920-882-6420. The #1 cause that I've seen of people not having insurance is that they have logged on at some point and not understood what they were doing. The website was confusing, they didn't understand the cost savings, they didn't understand how to choose a plan. That's why health insurance assisters like us are going to be so helpful to you to help walk you through that process. You'll really understand. We use some great health literacy materials. We've done this for years, so we know how to tell the information that you need to hear in a way that you can understand, and we enjoy doing it. So having free in-person assistance help makes all the difference in you choosing a plan that fits your family's needs, understanding where to go to the doctor, and understanding what it's going to cost you. We're going to be able to help you with the whole process, including if you don't have a computer at home or you're not technologically savvy, that's what we do. We'll even help you set up an email if we need to do that. And we'll help you push all the buttons and explain what's going on. You'll have the option of giving us a permission to sign it for you. You don't even have to touch our computers if you don't want, as long as you consent that we can help you in that way. We do a good job of explaining things, and we'll take care of all the technical issues for you. I can't tell you how many times people have come in after an illness, after a hospitalization, after somebody T-boned them in an intersection, and people who thought they were healthy and didn't need it are now in a world of hurt, not only physically, but they have huge bills at hospitals that they're going to have a hard time covering. Having insurance protects you. I'd rather have you pay every month for insurance that you don't use, other than going to your wellness visit, than having an accident and having bills that you can't pay. Anybody who tried it in the first year of open enrollment, there were some things to work out. It was a little squeaky. Everybody's improved. The website's improved. We do our work better. There are more insurance offerings, and it's more affordable than you would imagine. 8 out of 10 people qualify for financial savings. Quite a few people receive plans for under $100 a month, or far less depending on your income. Savings is available depending on your income, and I think you'd be surprised at how affordable insurance can be. Temp agencies offer insurance sometimes that isn't real health insurance. It might be some accident coverage. People who want to retire early and have a couple of years before they go on to Medicare need to find some kind of insurance when they stop working. Self-employed people who don't have anybody offering them insurance, or again, small companies that aren't required to provide insurance for their employees. All those people can look on the marketplace.
Oshkosh Today was supported in part by the Friends of OCM, Aurora Healthcare, 855 Northwest Haven Drive. Set design provided by House of Flowers, 1920 Algoma Boulevard.